Okay, so welcome everyone. It's a delight to be with you here this afternoon with the Intensive Care Society, looking at our climate change issues through this series. We're very glad to have you all here. I am Dr. Claire Bayntun. I'm a clinical consultant in global public health, and I'm Vice President of the Royal Society of Medicine, and we are delighted to be supporting this important series. Today's session will set out some of the reasons why we must act. Specifically, we must act on climate change. And we're going to give particular consideration to the impacts of our individual and our collective health, and looking at the co-benefits, and we will be highlighting some of those. We welcome your questions. Please put them into the Q&A function at the bottom of your screens. And I will aim to put these questions to the presenters after they have given their presentations. And I do recommend that if there are questions there that you particularly like, do upvote them as they're more likely to be picked. So first, I would like to now welcome Professor Hugh Montgomery. Hugh is Professor of Intensive Care Medicine at University College London. He's chair of the Lancet Countdown on Health and Climate Change and a council member of the Intensive Care Society. He has written and lectured on climate change issues over at least 3 decades and is world-renowned for this work. We're very grateful for your insights, Hugh. Can I pass over to you for your presentation, and I will introduce Francis after that.
Well, thank you very much indeed. Let me just make sure you can see my slide deck. If I take that. Good. So in the next 15-20 minutes, before I hand over to Francis, I'm going to tell you the story of why we need to act, the level of urgency and scale and pace that's required, and why we are now suffering from inaction. I've called it down to the wire because we are absolutely down to the wire now. But I also want to end with a bugle call for action, because it is essential that you don't just listen to this and become doom-laden. It is a very, very stark warning, but we all need to join together to take action. To take the old Irish proverb, you know, how would I get from where I am now to somewhere else? I wouldn't start from here at all. And I wouldn't start from here at all because the planet is in terrible trouble. On the y-axis here to the left, we've got the population in billions. And after 4.2 billion years of life on Earth and 540 million years of multi-celled life, we reached around 1/3 of a billion people on the planet 2,000 years ago. And not much changed until the industrial and agricultural revolutions, when the population really took off. So after 4.2 billion years of evolution, we reached our first billion on the planet in 1804. And it took another 123 years to add another billion to the planet, but only 33 years to add another billion. And we've been adding another billion every 12 to 14 years ever since. And we're currently about to punch through the 8 billion mark, which we're likely to do next year. So a lot of people. On the right-hand y-axis is domestic product for the whole world. And this is in inflation-adjusted dollars for 1990. And you'll see the shape of the graph is very much the same, with this massive uptick that occurred around the Industrial Revolution, but particularly in the last century alone. The scales, though, are very different. Whilst the population since 1804 has gone up by 1 billion, we've had an increase in global finance that's vastly greater. So per capita, what we're all responsible for spending has gone up 63-fold, whilst the population has gone up 8-fold. All of that is underpinned by resource use. And I'm not going to go at length into all of them, but let's just look at water. This is the planet with all the water in the atmosphere. So that's all the clouds drained dry, all the rivers, lakes, and so forth drained. That's the total amount of water on our planet compared to the size of our globe. This is the amount of liquid fresh water that we would like to use. And the amount that's available to us, though, is vastly less still. That's what's available in lakes and rivers. However, we need vastly more than that. Humanity is currently using 4,000 cubic kilometers of water a year for hygiene, washing, crop growth, and so forth. And there isn't enough. To subtend what we can extract from lakes and rivers, we're having to drain fossil aquifers or groundwater. And this is stuff that we can take out that doesn't refill in a sustainable fashion. So if we just look at Iran, 133 cubic kilometers a year of non-renewable water extraction. The United Arab Emirates, that had a 228 cubic kilometre aquifer that's now run completely dry. That won't refill for 10 million years if it ever does. And in China, if we look at the North China Plain, we've had an 11-metre drop in 14 years only in the fossil aquifer there. That, when it runs dry, will mean no wheat production for 640 million people. The high river basin, similarly, we're draining groundwater, and also a fossil aquifer with the numbers represented there. When that runs dry, that's the rice production, in fact, for 120 million people goes at once. But it's not just Iran, it's not just the UAE, it's not just China. The Ogallala aquifer in the United States, again, took many millions of years, for over 10 million years of essentially fossil water there. And if we look at extraction since 1930, you've had these colossal drops in the levels of those aquifers. When that runs dry, that's the wheat production for 8 states in the United States. If we look at topsoil, these are the data. 10 kilograms gets lost for every meal we eat, because when we plow soil, the topsoil gets broken up and blown away. And this paper from the early part of this century suggesting that by mid-century, we would run out of topsoil on which to grow land. Something echoed by Michael Gove when he was our environment minister, talking recently of only 30 to 4 years left of soil fertility in Britain. So things that we took to be perpetual, upon which we could rely, like water and soil, it turns out are not. And I just want you to notice the timescales here. We are talking about coming decades. We're not talking about the lives of our grandchildren. We're talking about us and our children now. In addition to that, we're destroying the ecosystems upon which we depend. As you can see here, for tropical deforestation, we're chopping down 1 soccer pitch of tropical rainforest every 2 seconds now. And if you look beneath that image, look at the volume, or the area rather, of rainforest we've destroyed. Since 1990, we've taken out an area of tropical rainforest roughly half the size of the whole of the United States of America, and we're still going at 1 soccer pitch every 2 seconds. All of this, including ingress of humans, chopping down of other ecosystems, pollution, and so forth, means that we're destroying the life on the planet. And the Living Planet Index, published by the Zoological Society of London and the Institute of Zoology, counts essentially the number of vertebrates and other animals on the planet. Since 1970, we're already down by nearly 70% loss of all vertebrate numbers on the planet. Central and South America, there on the right panel, very much worse. Freshwater vertebrates living in lakes and rivers, very bad. 84% have been lost. And fish overall, including fish in the sea, down by, again, nearly 70%. And it's not just the numbers that are going down. We're destroying species, rendering them extinct at a rate of about 8 every hour. And we are all now living through the greatest and fastest mass extinction this planet has ever seen, by a factor of around 10,000-fold. And we're responsible for it. So that's where we start. It's a very, very, very bad place to start. And on top of that, we now add climate change. And this from Bloomberg News only last month, talking really about the fact that a climate deal, something where we might get a deal in time to save humanity, those hopes are waning. And we'll explain why. Currently, we are polluting our planet with greenhouse gases that let shortwave radiation through and trap longwave radiation at a ridiculous rate. Just prior to COVID, this is what humanity was burning. And whilst there was a dip, which we'll come to later with COVID, we've now rebounded and are now emitting more than we did even in 2019. We're putting those greenhouse gases into a very small atmosphere. This image to the left being similar to that I presented for water, but here we've wrapped all the gas that surrounds the planet, our entire atmosphere, into a sphere at standard temperature and pressure. And if you put a very, very large volume of greenhouse gases into a very, very small volume of atmosphere, the concentration will go up, as the graph on the right shows. This inexorable rise here in the greenhouse gas carbon dioxide, going up very steadily indeed. Let's look at the rate of that on a geological timescale. On the bottom of the x-axis to the left, 800,000 years ago. And you'll see that over time, with these Milankovitch cycles, as they're known, CO2 rises and falls over time. But look to the right, that vertical line that we've achieved really most of that in the last 50 years. unprecedented in geological history at its pace and scale. This is where we were in May 2018 at 412 parts per million, and this is where we May this year at 419 parts per million. And I want you to remember those numbers, that we're currently at 419 parts per million, because that will become important later. Those greenhouse gases trap energy. This isn't about warming, this is about energy trapping. The equivalent of 2.8 billion Hiroshima bombs since 1998, or currently 5 Hiroshima bombs a second. And that's driving up atmospheric temperatures, as you see here. Remember, of course, though, that 90% of that energy has been trapped by oceans. So the Earth's surface temperature rise has been mitigated. That ocean and land temperature rise is causing ice melt. This is the extent of Arctic sea ice. And if we look at Greenland ice melt alone, we're losing around 1.1 million metric tons a minute just from that ice shelf on land, with that water pouring into the sea. As a consequence of thermal expansion of the oceans and of that added water, sea levels are rising, now at about 1 centimetre every 2 years, but for reasons we'll see, that was likely to get worse. But even with that rate of level of rise, when we look at the population threatened, we've got 1/3 billion people who will be underwater very shortly indeed. And we've got 2/3 billion also substantially at risk. Of course, people will move long before they're underwater. They won't be waiting until the high tide mark has actually drowned them. And furthermore, of course, as sea levels rise and storm surges appear, sedimentary rock and soil collapses in, lowering sea level in advance. And again, look at these timescales. This is happening this century over coming decades. And look at the numbers of people that will have to migrate. Even if sea level rise, it continued just at the rate that's occurring now. Add energy to an atmosphere, you get more extreme weather events, and each of those weather events will be more extreme in itself. So this from Carbon Brief, looking at the attribution of these extreme weather events to climate change, and you'll see the majority in recent history have indeed been driven by climate change. There are some where we don't know, and a few where it is clearly not climate change, but most are. And these will only get worse. Let's just remember that this was this winter for us, just before COVID. Australia ablaze, koalas functionally extinct. And remember those photographs of fruit bats dying and falling out of trees due to extreme temperatures. We've got an extensive fire in Siberia we'll come back to. That's peat essentially burning underground, destroying an area almost the size of Belgium just in the last year, and far more this year too. We've got California ablaze regularly, and those blazes getting worse. The Amazon ablaze, not just because Bolsonaro's policies are setting light to it, but because we're getting a tinderbox dry Amazon where lightning strikes will initiate new fires. And those fires are even more prevalent if we look at the rainforests of Angola and the Congo. They're happening in Indonesia. They're happening in Canada. Remember this year, those extreme temperatures nearly reaching 50 degrees in Canada. They happened in Greece. They happened in Turkey. They happened in Spain. They've happened in Italy. They're happening everywhere. And we're more and more familiar with these. And this is climate change at work. We've had flooding. Remember Belgium, remember Germany. That picture on the right there, you might remember there's massive flooding in Germany. We had it in London, those 3 major floods in August alone, stopping hospitals even from working. They were happened in China where thousands died. And who can not forget these pictures of the New York subway with their flooding too. With that, we also get droughts, we get cyclones and so forth. How are we acting on this? Well, we're not. The scale of the change we require is probably exemplified best by this, that even with global lockdowns during COVID-19, CO2 emissions only fell by 5.8% in total. And they've since, as I say, rebounded to much higher than they were in 2019. Well, if things are bad at 1.2 degrees where we currently stand, 1.5 degrees quite evidently is not going to be safe. And things don't stop if you just stop at 1.5 degrees. Remember that 1/5 of the CO2 we add to the atmosphere now will still be cooking our planet in 33,000 years, and 7% will be cooking our planet in 100,000 years. 1.5 degrees is absolutely not safe. Ice will continue to melt, sea levels will continue to rise, at an increasing rate compared to 1.2 degrees. What happens if we go beyond that? Well, as the Philosophical Transactions, the Royal Society reported in 2011, 4 degrees would be completely incompatible with a global organized community beyond adaptation, just a waypoint to much higher temperatures. Well, you might say, well, hang on, guys, we're heading for 1.5 degrees. That will be devastating and awful, but we're not going near 4. The bad news is the trajectory we're currently on is for 1,200 parts per million by the end of the century and a temperature rise of 5.5 degrees. And that's this century. And remember, things will collapse far, far before we even reach that point. Let me just let you read this. This is from Johan Rockstrom, director of the Stockholm Resilience Centre. The planetary stability our planet's enjoyed for nearly 12,000 years that allows civilization to flourish can no longer be relied upon. In other words, we can no longer depend upon the climate for the civilization in which we would like to live. This is the scientific working group, SR6. Oh, actually, this is the working group 1 report, the AR6, not SR6, reported in August of this year. Look at this. If global net negative emissions, we're not talking about just stopping emitting, we're now talking about having to suck CO2 out of the atmosphere in coming years. Even were this achieved and sustained, climate change will continue in their current direction for up to millennia. Things don't get better just because you stop emitting. And from a hysteresis, if you start drawing things down, things don't revert back to the way they were before for thousands of years, potentially. It would take several centuries to millennia for global mean sea level rise to reverse course, even under large net negative emissions. Species extinction, widespread disease, unlivable heat, ecosystem collapse, cities menaced by rising seas will become painfully obvious before a child born today reaches 30. So we are talking in every slide I've shown you so far at devastating impacts on human health and survival within the coming few decades of your lives. This from PNAS, published in 2020. Let's look at the scales of this again. If you look at temperature rises, around 19% of the land surface area where humans currently live will become uninhabitable. And that will lead to between 1 and 3 billion people moving, again, in coming decades. Think of the trouble that only a few hundred migrants cause politically, and then start thinking what happens when the whole of North Africa, southern Italy, France, and Spain become uninhabitable. Where do those people go? And what are the geopolitical and health impacts? Again, this is happening in coming decades. This is happening in your lifetime, not just of your children. But things could be much worse than that, because a lot of the impacts we see are non-linear. Warming has now reached the South Pole, which it hadn't done until the last couple of decades, when we've since seen strong warming. And look what the authors report. Just South Polar warming threatens everything we value that sustains us, that keeps us alive. Everything we value that keeps us alive is being threatened just by polar warming at the South. But things are changing much more quickly. As we've melted ice, less energy is reflected back into the atmosphere, more dark ocean and dark soil is there to absorb heat. And the rate of Earth's energy gain has doubled in only the last 14 years. So things are not moving linearly. Things are getting worse very, very rapidly indeed. And we've got positive feedback loops now that go beyond melting ice. Methane is being released from carbonated rocks. That's been identified in northern Siberia now. So warming is causing methane release. Methane being 80 times as powerful a greenhouse gas as carbon dioxide in its first 20 years. To that, we add melting methane hydrates. Many of you will have seen images of people being able to set light to bubbling gas appearing under lakes in Siberia, and warming wetlands that are also releasing, as we're getting CO2 released from burning tundra, to which I alluded earlier for the Siberian fires. We've got other positive feedback loops. Some of you will have seen this in the news. The Amazon has now become a net emitter of CO2 rather than just absorbing, because it has now become so dry and because we're deforesting so quickly. There are other things that tip over to sudden events. In terms of sea level rise, these are known as Danskard-Oeschler events. They've happened over 20 times in recent thousands of years or hundreds of thousands of years. And when they do, you get sea level rise in the tens of meters happening sometimes over only decades. And there's now a question about whether we have tipped into one of these sorts of events. If we have, sea level rise isn't going to be just inching up every few years, it will be accelerating dramatically. We also have systems such as the Atlantic meridional overturn circulation. This is the sort of figure-8 pattern of ocean circulation coming from warm water in the Pacific, and the Gulf Stream forms part of that. If that collapses, then Britain, for instance, gets temperatures and climate very similar to Labrador, approaching the Arctic Circle. We know that we are weakening that at the moment, and as the science has been reporting, we are now close to a point of critical transition in that. We just don't know when it will happen, and it's not predictable. AR6 points to this and says it's going to happen almost certainly, but we don't know when. And finally, let's look again at these timescales. In 1974, models were produced as what might happen to population resources and ecosystems with population growth, industrial output and pollution. And that's been revisited, and the DOI is the bottom right there, to say what was the best of those models that maps to what's actually happened, and how can we best reinform that model as to what might happen in the future. So this is where we were for the year 2000. If we move 2021 rather, this is where it would project to for 2030 through to 2050 and then end century. And you can see again, it's predicting exactly what the science is saying in every other regard. We are dealing with collapse potentially of human civilizations in coming decades if we don't change our ways. Populations collapsing, food production collapsing, industrial output collapsing, resources and ecosystems collapsing. And these have been raised, these concerns, not just by scientists, but also by the military, who in 2003 in the Pentagon were talking about climate change resulting in a significant drop in the human carrying capacity of the Earth's environment, by which that means many billions of people dying. Economists are saying the same thing. This is the World Economic Forum's Global Risks Report of 2021. Let's look at what's ranking in the top 10 as the highest risks in the next decades. Again, think of again, this is your lifetimes. And look what's in there: extreme weather, climate action failure, people not taking action, continued environmental destruction, the infectious diseases, which partly come from that, and biodiversity loss. And those highest impact risks, again, listing there: climate change failure, biodiversity loss, natural resource, and human environmental damage. Well, the chances are, though, that we could fix this. So this is where we need everyone to engage. The technology exists, and there is plenty enough money to decarbonize our economy. We can deal with no-till agriculture that spares soil. But we and we alone are the ones that can make the difference. For reasons we can discuss, we cannot rely on government to lead this nationally or internationally. Is it affordable? Yes, I personally think it's going to cost more than this, but the best estimates to date are that we'd only have to spend around 2.38 trillion a year worldwide, which is a small fraction of what's spent on health, or indeed in just maintaining fossil fuel industry at the moment. And bear in mind that to date, we've spent 11.7 trillion on dealing with the COVID crisis. So this is an affordable issue if we choose to address it internationally. I'm going to rattle through these because we can come back to them, and you can revisit this on the ICS website and through the Royal Society of Medicine, should you wish, at another time. But the first thing to do is measure your carbon footprint to work out what you're responsible for. Change your power supplier. I put the good energy link there, but ecotricity would be equally good. Change your transport, walking and cycling if you can. Don't fly if you can avoid it. Use mass transport where you can. And if you have to use vehicles, use cars where you car share. Use local, seasonable vegetable food products. Try not to eat ruminant meat. Remember, the cows are belching methane. And it's not just that. You're getting deforestation to grow the soya in, for instance, the Amazon to feed those cows. And we just all need to be using less. Don't think you can just offset your way out of it, because you can't. But when you've done all you can to reduce your carbon footprint, there are ways, for instance, of planting trees meaningfully. The real price is about £17 a tree for 21 kilograms of CO2. And you can look at that link there. Are we going to get a deal? Well, actually, time is ticking, not just for a climate deal, but ticking for our climate. And we need, as I say, to go for true zero, not net zero, because the trouble with nets is they're full of holes. And a little quiz for you here. When you hear net zero, what does it mean? Does it mean that you are allowed to emit, but you offset that by leaving trees standing, which of course isn't planting more trees to draw things down, by burning methane, adding more CO2, by buying emissions from another country to let them emit when to compensate for what you've emitted rather, or by helping others expand their economies by adding renewables to the mix. Well, the answer is all of those are counted as ways to offset your CO2 emissions. And it doesn't take a rocket scientist to realize that none of those reduce CO2 emissions at all. In fact, many of them add to CO2 emissions. There's stuff you can do at work. We can talk about those again. I'll flick through them because we can come back to it. But the call is for action. We can't leave this to other people. And this is your chance. And what an opportunity it is. The only generation that has the chance to save the biosphere of our planet and our fellow citizens on this planet. What a challenge, but what an opportunity for all of you listening to this talk to be heroes forever and ever, not just for a day. And with that, I'll hand back to Claire and then on to Francis. And thank you very much indeed for listening.
Hugh, thank you. Any single one of those slides is absolutely rich with information and causes us as the audience to think and reflect. Thank you very much. And I think it's particularly valuable, the resources you've given and the actions that you have laid out for us. I do urge the audience to refer back to these resources to actually gain fully from what Hugh has shared with us there. And so now for me to introduce you, Francis. Dr. Frances McGuire, her work on climate change is absolutely vast. She has a career that has spanned the climate change research, policy, advocacy, and education at the local, national, and international levels. She has worked in academia with NGOs and in the NHS, and has trained in the life sciences and in public health. Frances, over to you. Kindly share your thoughts and experience with us.
Thank you, Claire, and thanks for that introduction. Can I just check first you can see my slides?
Yes, clear.
Excellent, right. And is that moving down okay? No?
If you're able to put it onto the slideshow display at the bottom.
Let's just see.
So if you go to the bottom of your screen, to the bottom right, that's it. Next one along, to the right, to the right, to the right.
Yep.
That's the one.
There we go.
And then you can just click through.
Excellent. All right, you can see that then?
Perfect.
Thank you. Thanks. Sorry about the technology. Right, well, I did wonder how I was going to follow Hugh, and you might feel like I do and want to reach for the donuts or the chocolate or a strong drink or lie down. And my job really now is to try and help pick you up off the floor and look at how we move forward. I mean, as Hugh just said at the end there, this is the moment to be heroes for more than a day. This is the decade in which we can turn this around. If we don't turn this around, we're in trouble. But we have a decade, and this is the most exciting decade for anybody working in climate change and health, but for anybody on the planet, because we've all got a role to play here. So put the donuts down and let's think about health and climate change. So the Lancet Countdown was set up about 5 years ago, and without going into a huge amount of detail because we don't have a lot of time, but what we were trying to do and have had some success in, and I hope we'll have more success in, is to reframe climate change as a public health issue. And to give that a bit of context, I want to reflect a little bit about where has all of the focus now on climate change that we're hearing about so much in the media and run up to COP26, what's the history of it? And you've got to go right back at least to 1972. You go back a lot further, actually, but in terms of the international negotiations, it's worth going back to 1972. And what we've got here is a timeline for the political negotiations that started with the Club of Rome in 1972 through to COP26 this year in Glasgow. That's 50 years worth of negotiations, not just on climate change, but on sustainable development. So that covers some of the biodiversity issues that Hugh alluded to and other aspects of the sustainable development agenda. But all of the key UNFCCC meetings are laid out there. And underneath on a timeline are the key reports from the Intergovernmental Panel on Climate Change. And there's been 5. and the 6th is due out next year. There was a leak during the summer to alert us to how serious the report is very likely to be. I started work on climate change back in 1989. So that little green line at the left-hand side, I started just the year before that. And I was very lucky to be working with scientists, researchers who were contributing to the models that went into the first assessment report. And the team I was working in used that science, that evidence, very, very early evidence to look at to do an impact assessment for the UK. And it was the first impact assessment report of sea level rise. A young researcher working on this, 1989, the science was all a bit uncertain. We were looking out to 2035, 2050, 2100, and we weren't overly worried about it. It was all sort of a bit abstract. 30 years later, my career, very mixed, as Claire mentioned, academia, NGOs, public health, NHS, very rich, learned enormous amounts. 30 years on, it's serious, we're in trouble, as Hugh has very eruditely shown us. So taking one of Hugh's slides, you might have noticed the one that showed the inexorable rise. If you overlay that, those meters that I've just mentioned, you can see that for all of that research and for all of that political work, we're not affecting greenhouse gas emissions. We're not affecting CO2 emissions specifically here. So something isn't, quite biting, to say the least. But on the flip side, it's in 30 years, the science is in. We know what policies we need. We know who has the power. We know who needs to take action. The vested interests that have slowed action down are less influential, still powerful. So many things are in place, and we really are at a pivotal moment where we can start to bring this curve down, a little bit like the pandemic. We have to focus now to start bringing this down, bringing the emissions down. And public health and a health lens may really help us to do that, because this year we've seen a whole string of extreme weather events, climatic events that have taken place in a hotter world, a world that is hotter than it was 2 decades ago. So in 2000, I wouldn't have said to you, oh, this is definitely climate change. A specific flood is definitely climate change. There were floods in 2000 in the UK, and John Preston, the DPM at the time, said, this is climate change, and that's the front page of the papers, and everybody was a little bit, oh, you can't quite say that. Well, 20 years on, the scientific research and the ability to say that a certain event can be linked to climate change is much, much stronger. So we've got a series of events this year, the heat dome in Canada and the floods and all of the impacts that Hugh mentioned. So I won't go into detail on them again. But here you can see what it means in practice. Something like the heat event in Canada, nobody anticipated, nobody expected it, nobody knew how to deal with it. This is what it looks like. You have a cooling shelter for people who literally have got to find a cool space. They're lying down, they're resting, they're rehydrating with fluids. And these were set up obviously very quickly. So your profession will recognise this sort of approach to dealing with a crisis. Now I'm going to focus on the co-benefits so that we can sort of look at how do we change the conversation a bit. So it's not just about the impacts, but what are the benefits from taking action on climate change, not only to reduce gas emissions and to reduce the impacts, but how else do we benefit from it? And it's been summarised quite nicely in a slide here from the Lancet Countdown. I think the information there is well laid out. So I won't go into all the detail, but I will pick out the areas that we tend to discuss in this sphere, which is that as we take action to reduce greenhouse gas emissions, because we've got to, so that means moving away from fossil fuels, that means getting out of coal, it means transitioning out of gas, it means moving to renewables. That's wind, that's solar, that's hydro power, that might be biomass, it might be hydrogen from renewable sources. There's a range of energies, but it's not just the energy mix, it's how we move around, it's the kind of transport we use. All of those things can bring health benefits. They'll bring cleaner air. If we, by using less coal, we'll get cleaner air. By not relying on our private car, our personal car, we will be more physically active, and that is good for our health. We all know that. by switching to a more healthy diet or healthier diet, so less meat in the diet, a more some Mediterranean type based diet. There's a whole evidence base around this in the public health world, but healthier diets, that's healthy for us, it's healthy for the planet. And all of those come together to actually support our mental health as well as our physical health, with access to clean air and access to open space and high quality natural spaces, as we all experienced during the pandemic. That those people, we saw those inequities. We saw that people who could access parks, who could go for, I mean, I live in a village, I can walk in the hills whenever I want. The pandemic for me was really fairly straightforward in terms of being able to get recreational activity and get out and get some clean air. I was one of the lucky ones. And this slide from the American Lancet Countdown collaborators encapsulates again the co-benefits. This is sort of showing the health impacts of all the various different impacts that Hugh just mentioned. So agriculture, wildfires, transport, power plants, and all the different ways in which these have impact on personal health. And then obviously, if we remove those threats, the air pollution from power plants and from cars, the pollution that comes from agriculture, from cattle, and from using tractors and big machinery, remove all those, we've removed these threats to health. We've actually removed those health risks. So earlier this year in February, the Lancet produced a special issue, Planetary Health. And I would really recommend you dive into this. I'm not going to go into detail at all because it's pretty complicated, but have a look at it. That was written by authors that work within the Lancet Countdown, but also within and amongst partners of the Lancet Countdown and the London School of Hygiene. And I just wanted to show this slide because it's really quite striking. So one of the studies that's reported on in the journal looks at modelling what the impacts of reducing air pollution would be, of improving diet and increasing physical activity. And the models that were used show that in the 9 countries that were looked at, and they're all there and I won't read them out, but in those 9 countries, these would be the millions of deaths avoided each year or prevented each year if health policies were included in all the climate policies. And what really jumps out at you here, it's a model, so it's not a projection, it's not a forecast, it's a model. It's only as good as the data that goes into it and only as good as the interpretation of it. But what jumps out is the impact of diet. So you look at that with an improved diet, huge impacts in terms of deaths avoided in every country, but specifically, and you can see that in high income countries, the impact is in general more than it will be in a lower income country where diets are likely to be healthier with less reliance on red meat. I was asked to touch a little bit on economics, and in 20 minutes it's quite hard to do that, but this is one of the areas that the Lancet Countdown focuses on. We've got 5 working groups, and one of them is a group that looks at the economics and looks at the costs of the health impacts of climate change and its mitigation. So what does it actually cost to the health services, and in terms of the impacts on, say, prescriptions. I mean, I've got asthma, so I'll use a prop, but there's my inhaler, and I've got bags of these in the house that I've collected for the last few years just to show how much waste is generated for those of us who have asthma, but also where does that waste go? What's the cost of producing them? If I didn't have asthma, that would be a whole load of medications that we didn't have to be produced in the first place, but I do. So I do need my inhalers, and I live a healthy life as a result of having them. So I'm incredibly grateful for them, but also very conscious of their wider impact. The group also looks at financing the transition to zero carbon energy and economic transition to zero carbon economies. But I'm going to dive into a bit more detail into what does that mean for COP26, because COP26 is coming up really fast. It's in about 5 to 6 weeks, and the more I start talking about it, the faster I'll speak because I've got so much work to do around it. You will hopefully have noticed, particularly if you're listening and you're based in the UK, that there has been an enormous amount of media coverage this year about climate change, and I think hats off actually to certainly Channel 4 for doing some really long in-depth pieces about what climate change means and the co-benefits of climate change and how to get involved. But I think many media outlets have been doing some really responsible reporting. I'm sure not all of them will have been, but many are, and it's been very interesting. It's going to get really noisy as we get towards the negotiations. It'll get very hard to tell what really is going on and what happens, and even to understand the outcome. So it's always good to kind of go back to basics and look at what is the UN looking for from this. The negotiations are a set of negotiations that are linked to the United Nations. It's called the Framework Convention on Climate Change. It's a United Nations set of negotiations. It's complex. It involves 194 countries. It's very high level. It's very difficult to follow. It's expert led. Consequently, it can be really difficult for people who are not involved to understand whether it's making any progress at all and whether it's useful. These are the 4 tests. Will the talks deliver on an already promised $100 billion that should be exchanged really between high-income countries and low to middle-income countries annually by 2020? This should already be happening, but it isn't, and it hasn't, and it needs to. And people are looking out to see whether this is really on the table. The second one is around economics, and it's around a specific article called Article 6, which is about how do we pay for the emissions reductions that need to take place. And there are 2 key approaches, and those will be being argued about, if you like, or negotiated, which is perhaps a more diplomatic way of discussing it, but those will be a key part of the negotiations. And then what are countries saying about making deeper cuts and their plans for adaptation, for being ready for let's say the Canada heat dome or the wildfires or the floods? What are countries really going to do? What are the plans? How are we going to build resilience? How are our governments going to keep us safe from the impacts that we know are already happening and are only going to get worse? And re-engagement with observers and non-party stakeholders. And if you follow this at all, you'll perhaps know that recently huge concerns have been expressed about the fact that many delegates may not be able to attend from low-income countries because of the lack of access to vaccines. So those are the 4 big tests of success, so that at the end of the talks, we can look again and see, have these passed? And if they haven't, then the talks will not have been a success. And if they have, we will have moved forward. On the economic side of things, 2 key issues: emissions trading, and I'm not going to go into detail, but basically it's where you set a budget that you keep within, and then you trade underneath that budget. It's complicated, and they're still discussing how to do it. They've been discussing it for more than 20 years. It's frustrating that they haven't worked out how to do it yet. And it does make me think that perhaps it's not the most sensible way forward, given that it hasn't really worked so far, but it's still part of the mix. The other way of looking at it is carbon taxes, which are possibly simpler, putting a price on carbon and imposing taxes, but incredibly unpopular, as you'll have seen in France in recent years. But we have seen successes in public health where carbon taxes have been used to help to reduce alcohol use, to help to reduce tobacco use, to help to take sugar out of food products, and to help shift and nudge us towards healthier products that we consume. So carbon taxes need to stay on the table. There's a role for all of us to build public support for this approach, perhaps, to tackling the problem of reducing greenhouse gases. So one of my bugbears at the moment is that, of course, during the pandemic, so many of us are on Zoom, so many of us are in meetings where we don't even get to talk face to face. It's quite odd talking at people, not even knowing how many people are in the room and who they are. We've got to turn all the talk into action, because otherwise it's incredibly frustrating. COP26 also must not just be yet another talking shop, and I think we all perhaps know that Greta Thunberg has said she won't attend because she is concerned that it is a talking shop, and so she's working in other spheres to bring about change. And in terms of the Lancet Countdown for this year, we've got a launch of our next collaboration, which is based in Europe on the 23rd. So do look out for that, and that means that that's building capacity across Europe to work on climate change and health research, and then work across with policymakers and communication specialists. Our global report will be out in late October, before COP. We produce a series of policy briefings, which is one of the things I work on. And of particular interest perhaps to this audience is the work that will be done on that from MSF. And they produce a longer report on the humanitarian impacts of climate change and they're looking at 4 key case study countries this year, and where some solutions are now being brought to bear, particularly in moving to renewables and in MSF's own activities. And then we will be engaged in COP26 in one way or another. That might be virtually, that might be that we're there in one way or another. We do have conversations with the UK COP26 government team to talk about how to incorporate health into the agenda at COP26 to help to switch the framing a little bit, and maybe that will start to help us bring that curve down. And over the next couple of years, so in the medium term, working to build capacity in regional collaboration centres in China and Latin America and in small island developing states, and ongoing collaboration in India, Gambia, Australia, the US, Canada and Europe. And then one here, particularly for this audience, that we're keen to develop is CPD curricula, medical and public health curricula, CPD health and climate change, because otherwise what we have at the moment is ad hoc presentations, perhaps like this one, where people like me and Hugh come along, and I'm more than happy to do that. But what we need to be able to do is scale this up and make sure that anybody training in health, in any aspect of the health sector, whether that's public health, whether that's medicine, whether that's nursing, maternity, midwifery, physio, occupational health, anybody I might have missed out, I will have done, I apologise, but anybody who is training in health and healthcare begins to understand why climate change is critical to the work that we're all doing. We'll be doing all of that with our incredible range of partners around the world, academic and the WHO and WMO, an amazing group of people to work with. And finally, for you, if you want to do something, and I urge you to take action and not just talk, do look at the Healthy Climate Prescription, which is a letter that's been developed for the health community, particularly for health professionals, to sign up to. You can find it on healthyclimateletter.net. And that's been developed by health organisations working together in the run-up to COP26 to really emphasise some of the points around the role for health and health community to address climate change. Thank you for listening.
Frances, thank you very much. And your talk was very important in raising the issues about training. I'm particularly interested and excited in that work of making it accessible for people to learn more in a structured way on this arena. And both talks very much spoke to both climate action, but also that broader planetary health as its imperatives. So thank you for that. So now I move on to some questions. I'm just going to pose a couple in regard to the particular audience being from intensive care initially, and then I'd like to invite more questions from the audience. I know we have a couple in already. So in terms of a paper actually by Thomas Bean in 2020, Bean et al., I'm going to just read out a couple of sentences from that paper. To our knowledge, there is presently no specific activity in intensive care medicine to face current and future challenges in the context of global warming and climate change, although it is expected that intensive care medicine will need more specialised capacities, better knowledge on the part of intensivists, and better preparation for worst case scenarios, and in brackets, heat strokes or infectious outbreaks, to manage the consequences of climate change adequately. And he speaks a lot in his paper about looking at the different systems of respiratory, infectious diseases, kidney impacts with heat and dehydration, but also the need for surge capacity in certain regions, in particular around megacities and coastal regions. And so could I come to you, Hugh, and ask, what do you think is the need from an intensive care training perspective for managing what might be pretty uncommon diseases and presentations so that people can diagnose and treat quickly and effectively, and also in regard to that surge capacity? What do you think the future looks like, Hugh?
Well, if I was honest, I'd say that the focus would be in the wrong place. And I think we've done an awful lot of this. There's been a lot of focus in previous COP negotiations and elsewhere on adaptation and what can we do to help, adapt to things coming down the line. And the truth is, from what we've just presented, you can't adapt your way out of this. And my concern about the focus on saying, well, we could all learn to cope with more heat stress, et cetera, is that it's fiddling while Rome burns. We've got to take the public health approach to this, which both you and Francis are familiar with, and say, let's just not get that into that situation in the first place. Because whilst we might be able to temporize by understanding heat stress better, by understanding changes in infectious disease pattern, et cetera, it's not going to make the difference to the scales of people that will be affected by climate change and for which a health service won't be able to solve the problem. As we say, if you've got 3 billion people moving, into Northern Europe coming here, this is not something that's going to be a minor blip on the economy or food supplies or anything else. This is something that can't be fixed that way. So personally, I wouldn't be focused on trying to inject further work into that. And just as a way of example, if you say, well, actually, okay, we could create cool zones, hotels with air conditioning that we move people into. Well, where are these hotels when these heat waves strike? Do we kick all the tourists out of them and then suddenly move patients into them? And if so, how do they get there when actually a lot of the British roads tarmac isn't available to cope or isn't able to cope with the high temperatures that we'd be experiencing? So I don't think we can deal with this by adaptation.
Thank you, Hugh. Francis, if you wanted to come in on that, let me know.
No, I think that's fine. Super.
And then we've got a question there from Jack Missingham. I hope I pronounced your name correctly, and I'm going to read it out. It's quite long. With diet being such a big factor, is it time to start changing the wording surrounding advice? For example, on one slide, it mentions reducing red meat and processed food. I'm a firm believer that it should read eliminate red meat and processed meat, as well as dairy, white meat and fish, etc. To what extent do you agree with this?
Well, I'll pick on that one first. I mean, so in essence, I agree. I'm a sinner. I don't buy red meat, and I have tried to reduce my dairy footprint for the reasons you mentioned there, Jack. I mean, cows belching methane is massively a massive contribution to climate change, and actually a much easier win in some regards than CO2, because with its massive global warming potential of over 80-fold that of CO2, getting rid of methane quickly buys us a bit more time. Of course, it's not just, as you mentioned, you said cutting out dairy. It's not just about the red meat. So if you think of the milking of the cow that's belched all that methane, you then have to pasteurize the milk. And if you remember your school days, you'll remember that you learned that means flash heating, very quickly heating the milk to 72 degrees, and then flash cooling it. So you then put a lot of energy into cooling it very quickly. That's what pasteurization involves, and it's very energy intensive. And then you've got to keep that product essentially refrigerated right the way through its transport and shelf life. And that's why the splash of milk you add to your coffee has a carbon footprint far greater than the coffee beans they're roasting, their extraction, turning into instant coffee, putting in a glass thing, shipped, moved, and you boiling the water. I suppose the question then is messaging. It turns out the public don't take kindly to do not. So I suppose it's a question of the impact. I agree with your sentiments. In an ideal world, the answer is we should not be eating these things. But how do we get people there most effectively? The answer might be to get people to move onto the reduction and then to the cessation. But I agree with your sentiment. The answer is ideally we shouldn't be eating these things.
Thank you very much, Hugh. I just want to raise that Mark Hayden has written to us and shared a link in regard to paediatrics and their support. So for colleagues, Climate Acceptance Studios, Ride for Their Lives, that's the reference. I hope that can be shared with the audience in some way, perhaps afterwards through resources. And also Mark raises the issue in terms of intensive care before we wrap up on that, saying, should we abolish intensive care? He is in fact going to be out of a job if he does this, and spend the money on preventive health. I'm actually going to go to Francis for this, and then I'll touch on training and before we wrap up. So Francis, over to you.
Yeah, I mean, I think this is where we have to come from where people are at. I mean, people die every day. and they die from a whole range of diseases, accidents, chronic, acute conditions, and we can't just abandon those people and look to something bigger to try and change the bigger, but not deal with the day-to-day. We have to do both. We've got to be able to look after people today and provide healthcare that's caring, compassionate, efficient, effective, safe. And we've got to have that in a context that is protecting the life support system on which we depend, which is the planet. We need both. It's not an either or. We actually have got to do it all. And we've got, we've got to start now. So it's now and it's this decade. And if we do it and find ways to take all these things forward, and post-pandemic, we've got an opportunity to do things differently. It's up to us, isn't it, to persuade, for those of us who can, persuade governments. We've got to try and do it. For those of us who can't exert influence there, we need to work in our communities and in our own lives. But the power, lies in certain areas, and it's naive to think that we can change it on our own. We have literally got to work as a collective. We've also got to focus, and we've got to act urgently and not keep talking about it, and start doing things and making changes.
Yes, thank you, Frances. And Hugh, I'm going to speak for you on this one, because I've heard you say before, you looked around your intensive care ward and 14 out of the 15 patients shouldn't be there if they'd had better preventative public health aspects in terms of their life supported, which I felt was extremely powerful. Forgive me, Hugh, if all right, I'm just going to move on to the next question because we need to wrap up in 3 minutes. We've had a question in from Heather Baird, I think a colleague of yours, Frances. And Frances mentioned the need for climate change in healthcare courses. How can this be scaled up quickly and required, i.e. not just recommended, for health education to embed climate change and sustainability into teaching and assessments? I'm coming to you, Frances.
Yeah, well, I think that's exactly what needs to happen. I'm working on a bid to see if we can look into it. Yeah, I think we've got to find out what the barriers are to getting this into medical curricula. There's been a lot of work in recent years calling for it, and lots of young people and medical trainees are asking for it. I know that the problem is often that there's the curricula packed already and there's no space. So how do you create the space for this issue? But it's got to happen, hasn't it? It's so important. Because prevention is better than cure, and climate change is the ultimate prevention in terms of approach to prevention in terms of illness. So I don't think we quite know how to do it yet, but it does need to be legally, or not legally, but it needs to be embedded in curricula.
Formalised in that way. Hugh, we are out of time, but I'm wanting to give you 30 seconds. COP26. Who out of health professionals that the audience might know or we ought to know is going to be there at COP26 that we can look out for and see what they are saying?
Well, in essence, there aren't any stellar names. The negotiations happen in one place, and there's quite an effort made to keep the hoi polloi like us away from them. And actually, a lot of the negotiations already happened at what are known as the intersessionals. So Cancer Research UK will be there, the Lancet Countdown will be there, the paediatricians you've heard about will be there, cycling all the way from, in fact, some of my colleagues from Great Ormond Street, going up there to present petitions. But in honesty, I wouldn't want anyone to leave this thinking COP26 is going to solve the problem. Remember that graph that Frances showed, inexorable rise and not even a dent. And the reason for that is quite simple. There are a lot of people in the negotiation that don't want to deal. Russia, for instance, depends upon gas and oil exports. It does not want action on climate change. And there are many others in the same situation. The answer, and I take us back to the who wants to be the hero, the answer is in our hands. But we have to now act aggressively and together. And if we do, we will make big changes that leverage greater changes in financial markets. And politicians will respond to our pressure. But we can't sit back and think they're going to fix it for us.
Thank you, Hugh. And actually, it reminds me from the Lancet Countdown 2020 report, where it demonstrates that actually health has such a clear and important role in raising awareness. We're trusted and we're influential, and we have a very clear role to advocate on these issues. So it is actually reluctantly, because there's so much more we could have talked about, that I draw this to a close. Before I do that formally, please stay with me, Hugh and Francis. I want to let the audience be aware that the next session in this series is next Tuesday, not the Thursday, the 21st of September at 12:30, the same time. The webinar will examine the components of the average personal carbon footprint with data drawn from members of the Intensive Care Society, I understand, which sounds really great fun and interesting to see. The session will explore the impact of food on the planet, what it means to have a sustainable diet, which links nicely with a number of the questions today, and how public health can support the necessary changes. Speakers include Professor Tim Lang from the City University of London, Dr. Kristin Bash from the Faculty of Public Health, and also Dr. Fintan Hughes from Duke University. So it just to me to thank Francis and Hugh for fantastic presentations. Most grateful for the rich insights and experience that you've shared. I also want to call out a thank you to those who are behind the scenes, Eleanor, Cass and Chloe, who really are responsible for having allowed this to happen and make it happen. Thank you for the support you've given to this series. And also to you, our audience. It is through doing this work that we can make a difference, and that's why we're all here. I wish you all a rewarding afternoon and take care.
Okay.